I have somewhat of a more lighthearted topic. I focused it very much on sort of our lay audience, and I focused it on common questions that I get about skin cancer and about vitamin D levels. So what I wanted to tell you about was the skin cancer, and skin is composed of 3 layers. First, the epidermis, the dermis, and subcutaneous tissue, and most skin cancers arise from the epidermis. What's amazing is the epidermis continuously regenerates, and it regenerates every 4 weeks. We saw many slides earlier talking about the prevalence of cancers, and skin cancer, especially non-melanoma skin cancer, is the most common cancer, and oftentimes they don't show them on these Sears diagrams just because there's so many, and the number of skin cancer is so high that they don't include it in the graphs, otherwise the other curves would look a bit different. What's interesting in Pamela's last slide, you can see that skin cancer is increasing over time. We think because of UV tanning, more outdoor exposure, and that it's so common that 1 in 5 Americans will have a non-melanoma skin cancer in their lifetime, and often patients have multiple skin cancers. So this is just a diagram showing that melanoma, the deadliest form of skin cancer, is increasing. And when I talk about skin cancers, these are the most common types. Basal cell carcinoma, shown right over here. On the right, squamous cell carcinoma in the center. These two comprise of non-melanoma skin cancer, and melanoma arising from melanocytes is the most deadly, but generally the least common of the skin cancers. When we're talking about melanoma, we're talking about how do you detect it? What are the ABCDs? So many of you may have heard about this. In contrast to more invasive screening methods such as colonoscopy or imaging studies from CT scan, generally for skin cancer screening, you go to a dermatologist or even to your primary care doctor. And what are they looking for? They're looking for the ABCD changes. A stands for asymmetry, where if you were to fold the lesion in half, the 2 sides wouldn't match up. B stands for border irregularity. The borders are jagged or blurred rather than smooth. C stands for color variation, where you have 2 or more different colors, or also change when something has been growing rapidly in size. And D stands for diameter, and if the lesion is larger than 6 millimeters, that's something to worry about. And this is a pencil top eraser, and that's generally 6 millimeters. So any one of the features here is not necessarily concerning, but multiple of these ABCD features, you can do self-exams yourself, but certainly warrant a visit to your primary care doctor or a dermatologist. So I've made my talk into sort of the 4 most common questions I get when I speak to an audience on cancer prevention. And the first one is, are sunscreens good or bad? You might think, why would people ask this? Well, we're in the Bay Area. We've got a lot of patients who are very naturopathic and have read a number of things about nanoparticles and others where they kind of question the use of sunscreen. So I wanted to review the sunscreen controversy and to say that sunscreen is universally recommended by physicians worldwide, by not only the American Academy of Dermatology, but the World Health Organization as well. And what is the controversy? Well, there's some concern that if you use a lot of sunscreen, you might lower your vitamin D levels. And we've heard so much about vitamin D recently, that vitamin D higher levels are better, maybe for cancer prevention, for reducing autoimmune disease. Many of those studies are correlative and observational. I don't think any large randomized controlled trials have shown the benefits of vitamin D, but I think, as anybody who's interested in wellness and health, we would all like a panacea that would, help with every disease. I didn't even know this, but February is vitamin D deficiency month, so it's quite popular and, quite on the general public's mind. And a lot of this has been championed by some researchers who really do feel like vitamin D is the solution for everything. But I just want to qualify it by saying that, the large body of evidence requiring randomized controlled trials has really not really demonstrated vitamin D's efficacy, even though, newspapers and the media really love talking about it. So some facts about sunscreen. You generally apply it 15 to 30 minutes before going outdoors. And actually to cover most of your sun-exposed area, your head, your arms, your legs, your upper chest, usually you need enough sunscreen to fill a shot glass. And how many people really apply that thick of amount of sunscreen on yourself? I don't think anybody does, right? So just remember, whatever SPF that's listed on the tube, and SPF stands for sun protection factor, you're probably not getting quite as much as you think you are, just because you're not layering on and applying the topical lotion or cream as thick as possible. So I recommend, getting an SPF 30, SPF 60, and obviously if you're swimming, sweating a lot, you may have to reapply it. So what is the evidence that sunscreen actually does something? Well, in 2011, there was a publication of the largest randomized controlled trial testing sunscreen use versus non-sunscreen use in 1,600 patients in Australia. Now, in Australia, melanoma and skin cancer is a major problem. And so they followed these subjects for 6+ years and found that those subjects who were randomized and given free SPF 16 sunscreen and asked to use it daily had a reduction in melanoma risk by 50%. So I think this is the largest trial and the best evidence showing that sunscreen really does work. This is called a Kaplan-Meier plot, and this shows you the number of patients that have melanoma. The yellow line shows the subjects that did not have sunscreen, and the blue line shows the subjects that use sunscreen. And so they've followed these subjects for many, many years, and you see a 50% reduction in the subjects who applied sunscreen, especially for melanoma, and this is the most critical and deadly skin cancer. So my patients often ask me, well, if I use sunscreen, and even if I don't use it quite as to the extent that you'd like me to, does it lower sunscreen? Why is this important? Vitamin D is synthesized in your skin, and the key synthesis of vitamin D is sun-directed. So the sunlight catalyzes the conversion of 7-dehydrocholesterol in your skin into vitamin D3. Vitamin D3 is then metabolized and hydroxylated by the liver, by the kidney, and the blood levels of 25-hydroxy-D is what you actually measure to determine your vitamin D status. This slide also shows you that vitamin D can be obtained by the sun and also by diet. So, we always recommend sunscreen, avoiding noontime sun, wearing long sleeves, wearing a hat to reduce your skin cancer risk. So we conducted a cross-sectional study where we analyzed 6,000 American subjects from a database called NHANES, and these 6,000 participants answered questions of how frequently on a sunny day do you use shade to protect yourself, wear long sleeves, wear a hat, or use sunscreen. And what we found is that actually sunscreen use really doesn't do very much to lower your vitamin D levels. What actually does lower your vitamin D levels is if you stay in the shade all the time, if it's a sunny day. I mean, that's not too surprising. If you wear long sleeves all the time, and obviously a hat doesn't cover very much of your skin, right? And so that doesn't affect your vitamin D levels as well. But in terms of the absolute amount of vitamin D levels that it changes, how much does it change? Well, if you do use the shade, wear long sleeves, it probably lowers your vitamin D levels by 4 to 5 nanograms per ml, so not that much. Earlier in the keynote address by Marcia, she emphasized physical activity and BMI. If you are overweight, if you are sedentary, those things also lower your vitamin D levels, actually much more than you might think from sunscreen. So the next question I get is, how do you get enough vitamin D? So this is the Institute of Medicine's recommendation for how much vitamin D you should take depending on your age. And so for this audience, I focused on men and women between age 51 and 70 years of age. And their daily recommendation is 600 international units per day. And if you take it with calcium, the absorption of both is better. So I've listed both here. The maximum amount, just because many of my patients will say, well, if some vitamin D is good, then more is often better, right? So I just want to remind you that there is an upper limit of vitamin D intake, and that's roughly 4,000 units per day in adults. And you might think vitamin D is so good, what harm could it be? Well, the Women's Health Initiative actually showed that if you did take, the women who were randomized to take vitamin D did have an increased risk of kidney stones. So there is some risk as well. So take the right amount that you need, and please don't exceed that. So if you're worried about your vitamin D status, then you ask your physician to order a test for serum 25-hydroxy-D. And so if that level is 10 nanograms per ml, that's really low. And if you are a young child, then you're at risk for bone disease, a bone disease called rickets. And if you're an adult and you have very low levels of 25-hydroxy-D, that's less than 10 nanograms per ml, then you're at risk for osteomalacia, which is a fancy word for bone pain. The level of 20 nanogram per ml is accepted for the level that you need to maintain adequate bone health, and then others have suggested levels greater than 30 nanograms per ml for optimal disease prevention. But importantly, it should be above 20 nanograms per ml. So how do you correct vitamin D deficiency? So a simple adage is 100 international units increases your serum 25-hydroxy-D by 1 nanogram per ml. So if you get your 25-hydroxy-D vitamin D levels checked and it's 16, well, 16 is 4 nanograms per ml less than the recommended baseline, which is 20. So 4 is what you need to, 400 international units is what you need to supplement. And just as a reminder, in terms of oral vitamin D, there's the vitamin D3 kind that's usually available over the counter at Whole Foods, at other stores, and they often dispense it in tablets of 1,000 to 4,000 international units daily. If you're severely vitamin D deficient, then you may need a prescription form of vitamin D2, and that's supplied as 50,000 international units weekly. D3 or D2, we don't see much of a difference in terms of changing the total amounts of serum vitamin D, so either one is fine. The last question that I often get is, can vitamin D be replaced by sun tanning? It feels like physiologically we should obtain vitamin D from natural sources, right? The natural sources may be usually the sun. I don't like to take supplements, or I don't eat enough mushrooms or salmon, and I don't like to drink cod liver oil. So can I get my vitamin D through sun? We asked this question, and this is a phototherapy unit, a light box, where we ask patients with bad rashes to step in so we can treat the bad rashes with UV light. We enrolled patients in a randomized control trial. We enrolled young, healthy patients and older patients. And we asked the question, gosh, if you take healthy adults and that only differ by age, younger was less than 30, older was greater than 50, what is their skin's ability to synthesize vitamin D? So we gave them the same dose of UV light and measured their vitamin D levels over time. And you can see in the graph of the younger patients, their blood levels of vitamin D skyrocket up after UV light. However, patients with older skin are not able to synthesize as much vitamin D. So I think this also answers the question of, it's wonderful to obtain vitamin D from UV light, but your ability to actually make vitamin D does decrease over time. And so unfortunately, if you are low in vitamin D, please do take the oral supplements and avoid the UV mutagenic hit and avoid getting skin cancer. So the summary, question 1, I hope I've answered that. Sunscreens with large clinical trial data does prevent skin cancer. Question 2, avoiding the sun, wearing long sleeves has more of an impact on your vitamin D levels, not sunscreen. Question number 3, it's safest to get oral vitamin D through oral routes, either by dietary foods or by supplements, and not by tanning. And question 4, aging skin cannot make as much vitamin D from the sun compared to youthful skin. So in the last 3 minutes, maybe I have time for a question or two. Thank you. Yes, please.
What do you think about these spray sunscreens, which are much easier to apply, but maybe aren't good for your lungs?
Yeah, Really good question. I mean, some of the controversy around spray sunscreen is the fact that the sunscreen ingredient, zinc oxide or titanium oxide, they're micronized or made into nanoparticles. And around here, a lot of people read the Environmental Working Group, and they have had some suggestion that maybe nanoparticles aren't so good for your health, especially if you inhale it. But the Environmental Working Group actually has come out in a position supporting nanoparticles in sunscreen. They don't support nanoparticles for cosmetics, because at least even if titanium oxide and zinc oxide are made smaller, people might use them a lot more. So I'm not worried about the inhalant risk.
Can you get
Yes.
enough sunscreen that way compared with the shot glass
Approach? Yeah, I mean, I think if you really do apply it, I think it rubs off more easily. You have to have more frequent application. But yes, I think they're pretty close. And I think it's, you know, sunscreens, the spray-on may not be perfect, but especially for little kids, if they're willing to do it, it's better that than nothing. Yes, please.
Do you have a sense of where you get most of your vitamin D from the sun or from the diet?
I think in older individuals who unfortunately are not as physically active, who are more sedentary and indoors, I think the majority of the D is probably from diet or supplements. We see such a huge difference in our patients who take the supplements versus don't. Marcia.
Could you just say something about tanning beds for the students that are?
Oh, yes, yes. So perhaps I didn't mention this enough. Part of the reason why melanoma and non-melanoma skin cancer is rising so much is because of the adoption of tanning beds. And tanning beds are actually not so well regulated, and there's a lot of advertisements saying that they give UV rays that are less harmful than regular sun. And unfortunately, especially in the southeastern parts of the U.S. where tanning beds are widely accepted, we're seeing a huge rise in skin cancer in women in their 20s and 30s, and especially in areas that, you know, are generally not chronically exposed. So there is absolutely no question that indoor tanning contributes to skin cancer and aging. So, great. Yes, please.
Can you just talk a little bit about, I mean, being that I'm darker skinned, oftentimes when I go outside and I don't wear sunscreen, it's harder for me to get like a sunburn, but is that indicative of the fact that I might have lower skin cancer rates than someone who's more Caucasian, or is that just a myth?
Nice healthy melanin in your skin, so your odds or risk of skin cancer is lower than somebody who's very fair skinned. But chronic UV exposure, even without a sunburn, can contribute to skin cancer. But the actual linear amount or the correlation is not well known. We're doing large genetic GWAS studies to try to answer those questions. And unfortunately, we also see a lot of skin cancers in Latin populations, especially in patients who work outdoors in the farmlands. And even though they have nice, healthy pigment, if they've been working outdoors for a large amount of their life, they will get skin cancer as well. So thanks for that question.